lateral, the swelling up in this area. So really, you just want to cover it and go beyond the area of swelling. So if the swelling goes to here, you probably want the ends to just pass it by about that much or so. You don't want to end it here if the swelling ends here.
Okay.
Just go about maybe an inch and a half, 2 inches. It's okay. If you go beyond, it's okay.
Do we always want the tape, the thick end here, and fingers pointing
Yes.
down? Okay.
Yes. Does it matter? Probably not.
Okay.
I'm just so used to doing it that way that I continue to do so. Kinesio and KT both used to say that you used to draw fluid to the base where it doesn't have anything. I don't believe that. I think it's a good theory, but I'm not sure that that truly occurs. I think the main reason why it helps with swelling is that it just creates so many zones of differential pressure that just helps, it helps move fluid that way. So the big thing about this is that the person needs to have their skin in a stretched position. So he needs to plantar flex as best as he can, and probably invert. Just you don't have to strain yourself, do what you can. And then when you take it to the very end, forming a tab, and then just tap it down like that. So no stretch. Okay, completely no stretch. If you do it this way, that's 10% stretch. You see how much longer it is? Is it okay? You probably can get away with it.
Okay.
In fact, I think Kinesio teaches paper off tension for edema. KT tape teaches no tension. So I got into the habit of doing no tension. And that's assuming this is the zone of edema or effusion. I like to, if I can, try to bring the legs, the ends close together, so that that way they're not 5 separate ends floating around. And that's because if you were to put on socks, it kind of pulls on it,
I might have to do mine over.
which is okay. It's just decreases the likelihood. Or what you can do is, after you tape it, put a top end on it, which is why we go beyond it. It helps too. And then behind the malleolus here, and then down this way. So that's the way it kind of looks. So this is not bad, not the best tape job I've ever done, but that's where, if this were the area of swelling, that would help him out a lot. If it was a pregnant lady who had swelling, general swelling of the ankle, then I would actually start up higher. I'd probably start up here, and I would put a medial one, and would have the fingers come across this way, and this finger come across this way, so they intersect. Okay. So let's just say Steven sprained his foot because he's walking, which is not uncommon. So in an acute sprain for this type of event, first thing I'll probably do, evaluate, hey, how much let me see you plantar flex, let me see you dorsiflex, so range of motion, right? I'll look for range of motion. And then I might do some resistant range of motion, passive range of motion. I'll probably do anterior drawer, talar tilt, Varus stress test to see if they actually have a sprain. Honestly, I probably won't do Varus stress tests. I would probably just do drawers and leave it at that. If the ankle's already swollen, you will have inconclusive findings because there's just possibly so much effusion and edema that joint's not giving the amount of play that you really want it to. And that's true for any joint in the body, especially knee. When it's blown up like that, you're not getting McMurray's for one. You're not getting Apley's or Lockman's. If it's blown up that much, it's torn. Something, at least one thing is torn. ACL's torn, MCL's torn, medial meniscus, depending on the activity.
If you have a patient that hurt their knee and say they're swelling, with the swelling, as far as doing the test, would you still perform the test that day, or would you wait? One reason I said that, my girlfriend, she tore her ACL, didn't know it was torn, went to the doctor, I think chiropractor, the next day that she did it, and he did the test, but there was swelling. So he couldn't find anything or whatnot.
It's hard to tell.
When she came back a few days later, he didn't redo the test. And then she ended up going to an orthopedic doctor that did the test and he couldn't find anything either. Her ACL was actually torn, but I just thought it was weird that the first day with the swelling, not that it was weird that he did it, but he didn't do it when the
Follow up?
swelling was down.
Yeah, he should have done it. Hard to say what occurred. It's possible that he didn't know that if there's effusion
Mhm.
or edema in the area, that it affects the outcome. Maybe he doesn't do that much of it, or he just
Yeah,
don't know.
yeah.
That's a possibility. But to have a follow up with an orthopedist that actually did the test, most likely she just had a mild ACL tear, right? I
Yeah.
just assume.
Yeah, it was a complete tear.
Oh, it's a complete tear?
Yeah.
Oh.
Yeah, she had to get surgery on
Yeah, usually you should have pretty good movement of that tibia.
it. Mm-hmm.
Boy, it makes. If
They
there's no
both
swelling.
had trouble finding it. I mean, she was on it for like a month before the surgery and was able to walk and everything. She was fine, but it was weird place.
Yeah, it's hard to say.
Where it was actually torn. I think that's why it wasn't.
If it's complete torn of the ACL, there's nothing holding that tibia from translating forward. If she's pretty muscular Chiquita, it's